this is Dr. Emma Hitt-Nichols, and this is the information on the latest U.S. FDA approvals for July 15th through the 19th, 2024. First up this week, the FDA has approved vonoprazan, also called Voquenza, for the treatment of non-erosive gastroesophageal reflux disease, GERD, in adults. Vonoprazan, an oral small molecule potassium competitive acid blocker, also called PCAB, is already approved for treating all severities of erosive esophagitis, EE, also referred to as erosive GERD, and in combination with antibiotics for eradicating Helicobacter pylori, H. pylori infection. PCABs represent a novel class of medicines that inhibit acid secretion in the stomach. Non-erosive GERD is the largest category of GERD, characterized by reflux-related symptoms in the absence of esophageal mucosal erosions. An estimated 45 million U.S. adults live with the non-erosive GERD, with approximately 15 million treated with prescription medicines annually. Despite existing treatment options, many patients remain dissatisfied and continue to experience symptoms impacting their quality of life. This approval was based on findings from the Falcon-NERD 301 study, a phase 3 randomized placebo-controlled trial. This trial evaluated the efficacy and safety of vonoprazan for daily treatment in adults with non-erosive GERD. Results demonstrated that vonoprazan significantly reduced heartburn episodes and provided more complete 24-hour heartburn-free days and nights compared to placebo. The approval of vonoprazan was granted to Phathom Pharmaceuticals. The FDA has granted Fast Track designation to ADI-270 as a potential treatment option for patients with metastatic or advanced clear cell renal cell carcinoma who previously received an immune checkpoint inhibitor and a VEGF inhibitor. ADI-270 is an allogeneic, off-the-shelf CD70-targeted gamma-delta CAR T-cell therapy candidate. It is directed towards CD70 using the natural CD27 receptor and features a dominant negative form of the transforming growth factor beta receptor 2 intended to deliver functional resilience to the immunosuppressive tumor microenvironment. Additionally, ADI-270 is designed to increase exposure and persistence by reducing susceptibility to graft versus host elimination. A phase 1-2 trial will investigate AD-270 in patients at least 18 years of age with histologically or cytologically confirmed ccRCC who have documented evidence of advanced or metastatic disease and have previously been treated with an immune checkpoint inhibitor and VEGF inhibitor. The primary endpoints are the incidence of dose-limiting toxicities and the proportion of treatment-emergent and related adverse events. ADI-270 is being developed by Adicet Bio. Also this week, the FDA granted both Fast Track and Regenerative Medicine Advanced Therapeutic, RMAT, designations to Lomecel-B, an investigational allogeneic medicinal signaling cell, MSC, therapy for the potential treatment of patients with Alzheimer's disease. Lomecel-B is designed as an allogeneic MSC therapy to address the neurodegenerative aspects of Alzheimer's disease, which leads to progressive memory loss and death. The critical need for effective treatments for AD is highlighted by the lack of therapeutic options that slow disease progression or improve cognitive function. Lomecel-B demonstrated an overall slowing and prevention of disease worsening compared to placebo in the Clear Mind Phase 2A clinical trial. The trial included 50 patients aged 60 to 85 years with mild Alzheimer's disease. The trial met its primary safety endpoint with no new safety concerns, cases of amyloid-related imaging abnormalities, clinically asymptomatic microhemorrhages on MRI, or notable changes in laboratory evaluations and electrocardiograms observed after the 39-week treatment period. The trial also achieved secondary efficacy endpoints, showing statistically significant improvements in pre-specified clinical and biomarker endpoints in specific Lomecel-B groups compared to placebo. Lomecel-B is also being investigated for the potential treatment of aging-related frailty and hypoplastic left heart syndrome. Lomecel-B is being manufactured by Longeveron. And now a word from the supporter of this podcast, Learn AMA Style. If you're someone who writes about medicine or science, say you're an MD, PhD, medical writer, or pharmaceutical industry executive, then you should visit learnamasstyle.com. At that website, there are several free downloads that will help you implement AI reliably into your work, as well as a downloadable list of prompts that you can use, and also lots of information on the AMA Manual of Style, which is the industry standard. Check it all out at learnamasstyle.com. That's learnamasstyle.com. Also, last week, the FDA accepted an investigational new drug IND application for ART26.12 aimed at treating chemotherapy-induced peripheral neuropathy, CIPN. This clearance allows the initiation of a phase 1 single ascending dose study in collaboration with worldwide clinical trials. ART26.12 is the first selective fatty acid binding protein, FABP5 inhibitor to enter clinical trials and is part of a proprietary platform developed by the manufacturer. The mechanism of action involves inhibiting FABP5, an intracellular protein involved in lipid signaling, offering a non-opioid approach to managing painful neuropathies. The preclinical evidence has shown efficacy and the potential to treat multiple conditions, including cancers and neuropathic pain. CIPN affects up to 90% of patients receiving chemotherapy, and it can lead to dose reduction or cessation of chemotherapy, negatively impacting treatment outcomes. Currently, there are no FDA-approved treatments for CIPN. The IND for ART26.12 was granted to Artello Biosciences. Phase 1 trial results are expected in the first half of 2025. Also last week, the FDA authorized marketing of Simplexa C. auris Direct, a molecular-based assay intended to detect Candida auris C. auris DNA from a skin swab of the armpit or groin from patients suspected of C. auris colonization. The test is intended to help prevent and control C. auris infections in healthcare settings. The assay may allow healthcare professionals to evaluate patients for colonization with C. auris faster than traditional culture-based techniques when such testing is needed. Faster detection can help stop the spread of this organism, which is frequently resistant to multiple antifungal drugs and can cause serious infections in hospitalized patients. The Simplexa C. auris Direct test has been developed by Diasurin Molecular LLC. Following an end-of-phase 2 meeting, the FDA advised against granting accelerated approval for the investigational immunotherapy combination regimen consisting of botensilimab and balstilimab being evaluated in patients with relapsed refractory microsatellite stable MSS metastatic colorectal cancer, mCRC, without liver metastases. Botensilimab is a human monoclonal antibody that blocks the CTLA-4 protein, enhancing both the innate and adaptive immune responses against cancer. It is designed to elicit therapeutic benefits for cold tumors which have suboptimal responses to standard treatments. Balstilimab is a PD-1 blocker that complements botensilimab by restoring T-cell ability to fight cancer. Phase 2 interim data showed that the regimen elicited an overall response rate of 19.4% over an average follow-up of 9.5 months. Increasing the dose to 150 milligrams resulted in an overall response rate drop to 8.2%, and monotherapy at either 75 milligram or standard of care resulted in a 0% overall response rate. Despite the overall response rate, the FDA discouraged seeking accelerated approval for the combination, noting that the overall response rate may not translate to a survival benefit. The immunotherapy combination is being developed by Agenus. All right, that's it for this week. Thank you so much for listening. Again, tell your friends or colleagues. And who I think would really benefit from this podcast is medical students in medical school. You have so much information. And if you're driving in your car on the way to your next class, maybe you can listen to this and sort of just get like a little snippet of information for all of these different things that you guys have to learn. That's really tough. So have a wonderful week. Thanks for listening.